In my own family, I've had a number of family members with GI conditions, both ulcerative colitis and colon cancer. My grandfather, who I'm named after, actually passed away from colon cancer before I was ever born. So I think probably in the background that was one thing that pushed me towards GI. And one of the wonderful things about GI, I think, is that it combines longitudinal patient care with being able to do procedures that can help people. And specifically for me, I chose inflammatory bowel disease because I really appreciate developing long-term relationships with patients. It really is that partnership with the patient that's crucial. And so it's a complex disease, there's no cure, but we have effective therapies, and we're constantly working with the patient to find the right treatment plan that's going to help them achieve their goals in life. Fortunately, we have a large clinical trial program at the Cleveland Clinic. My role is partially in directing the clinical trial program. So even if a patient hasn't responded to one of the traditional therapies, we have other options for them in terms of medical therapy through clinical trials. Some patients I may be seeing right at their first diagnosis. Maybe they've just presented with symptoms of diarrhea or rectal bleeding, and we have to do the initial workup to figure out what's going on, whether that could be Crohn's disease or ulcerative colitis or some other GI condition. And so we'll talk about what's involved in that workup, whether it be doing a colonoscopy, endoscopy, getting different kinds of imaging tests. In many other cases, I may see patients who have been previously diagnosed with Crohn's disease or ulcerative colitis. Maybe they are not where they want to be in their care and they're looking for another opinion. In that case, we're going to go through a detailed history of their disease, their symptoms, what's been done for them before, go through all of their extensive medical records from those workups that they've had, and try and come up with a plan together for how we're going to approach their disease process. In addition, we have a unique approach to caring for the whole patient in our IBD medical home, where we work closely with the GI psychologists and nutritionists to provide really well-rounded care to patients with Crohn's disease and ulcerative colitis. So I think that initial visit is a longer visit where we want to get to know the patient, how the disease impacts their life as a whole, to come up with a strong multidisciplinary plan for how we're going to get them better and achieving the quality of life that they desire.